Have you ever experienced dizziness, nausea, spasticity, loss of balance, or vision loss? If so, you may be experiencing the onset of multiple sclerosis, a disease in which originates from an unknown cause and is often difficult to diagnose. Multiple sclerosis, or MS, is best defined as an unpredictable, disabling disease that occurs when nerve cells in the brain and spinal cord are damaged. Approximately 2.3 million people have MS. MS is most common in 20 to 50-year-olds, and it is most prevalent in women than in men.
In a normal neuron, you have the cell body with dendrites at the ends. Then there is the axon coming off of it, and at the end, there is the axon terminus. The cell signaling in these nerve cells work like this. The signal goes through the dendrites, and the impulse flows through the cell membrane and through the axon. Then when it reaches the terminus, the neurotransmitters pass on the signal to the next cell until it reaches the target. But in a cell that is affected by MS, the main thing affected by this disease is the myelin sheath, which protects the axon here. It is the sort of covering that is very important in carrying the signal across the axon. So, when the myelin sheath deteriorates because of MS, the signal cannot continue, and the target cell never gets the signal.
People with MS also have relapses, or attacks that include the extreme worsening of symptoms for a short period of time. These relapses occur frequently after the onset, but typically occur less often over time. MS is not fatal. A majority of victims will live up to the average life expectancy. MS is chronic, and almost all victims will need mobility assistance by either crutches, canes, or wheelchairs. Though there are no current cures for MS, researchers are optimistically searching for an answer. The FDA has released many medications for MS patients to help them manage their symptoms and reduce their relapses. The most common drugs prescribed are Novatrone and Diet Substitute, which help to reduce pain levels and make life manageable for people with multiple sclerosis.